Check accuracy and completeness of each MAR with healthcare provider's medication order. Check patient's name, medication, name and dosage, route, and time for administration. Clarify incomplete or unclear orders with healthcare provider before administration. Review pertinent information related to medication including action, purpose, normal dose, and route. One or both ears. Side effects, time of onset and peak action, and nursing implications. Assess patient's medical history, medication history, and history of allergies, including latex. List medication allergies on each page of the MAR and prominently display any allergies on the patient's medical record per agency policy. When patient has allergy, provide allergy bracelet. Perform hand hygiene, assess condition of external ear structures. This may be done just before medication installation. Apply clean gloves if drainage is present. Determine whether patient has any symptoms of ear discomfort or hearing impairment. Assess patient's level of consciousness and ability to follow directions. Assess patients' or family caregivers' knowledge, experience, and health literacy. Assess patients' knowledge, prior experience with ear medication, and feelings about procedure. Assess patients' goals or preferences for how skill is to be performed or what patient expects. Assess patient's ability to manipulate and hold ear dropper. Perform hand hygiene, collect appropriate equipment, and MAR. Prepare medications for installation, attend to procedure, and avoid distractions. Check label of medication against MAR 2 times. Naimbag nga aldaw mo ma'am, siya niya na may centeno, student nurse mo tata. Namagak man ma'am no anya tinagan mo, kung birthday mo.
Siya ni Ben Marian Prata. Birthday ko kat July 21, 2006.
Damagak man ma'am no adabati al-allergy ti makmakan or latex gloves, nanyaman.
Awan po.
Ma'am, i-check ko man datala payag mo no adaman ti problema na. Yati mariklik na mo no ikastoy po ate na paano ma'am, nasakit ba? Tibangan ma'am. Prepare medications for installation. Attend to procedure and avoid distractions. Check label of medication against MAR 2 times. Take eardrops out of refrigerator and rewarm to room temperature before administering to patient. Preparation usually involves checking label when removing eardrops out of storage and before leaving preparation area. Check expiration date on container. These are the first and second checks for accuracy. Perform hand hygiene. Take medications to patient at correct time. Consider whether medication is time critical. During administration, apply the 7 rights of medication administration. Arrange supplies at bedside. Identify patient using at least 2 identifiers, name and birthday name and medical record number, according to agency policy. Compare identifiers with information on patient's MAR or medical record. At patient's bedside, again compare MAR or computer printout with names of medication on medication labels and patient name. Ask patient about any allergies. This is the third check for accuracy. Explain procedure to patient and sensations to expect. Discuss purpose of each medication, action, and possible adverse effects. Allow patient to ask any question about the medications. Patient who self-instill medications may be allowed to give drops under nurse's supervision. Perform hand hygiene. Administer eardrops. Perform hand hygiene. Position patient on side if not contraindicated. With ear to be treated facing up, or patient may sit in chair or sat beside. Apply clean gloves if ear drainage is present. If cerumen or drainage occludes outermost part of ear canal, wipe out gently with cotton tip applicator or washcloth. Take care not to force cerumen into canal. Always clean only outer canal. Do not push cerumen or secretions into ear. Hold the container in the palm of your hands for a few minutes to warm the contents to body temperature. Then if the eardrops are in a cloudy suspension, shake bottle for about 10 seconds. Straighten ear canal by pulling pinna up and back to 10 o'clock position, or down and back to 6 to 9 o'clock position. Pull pinna up and back for adults and children older than 3 years. In still prescribed drops, holding dropper 1 cm above ear canal, avoid contact of dropper tip against external ear canal. Ask patient to remain in side lying position for a few minutes. Apply gentle massage or pressure to tragus of ear with finger. If ordered, gently insert part of cotton ball into outermost part of canal. Do not press cotton into canal. Remove cotton after 15 minutes. Help patient to comfortable position after drops are absorbed. Nurse applies gentle pressure to tragus of ear after instilling drops. Administer ear irrigations. Assess the tympanic membrane or review medication record for history of eardrum perforation which contraindicates ear irrigations. Help patient into sitting position or lying position with head tilted or turned toward affected ear. Place towel under patient's head and shoulder and have patient hold basin under affected ear. Fill irrigating syringe with solution approximately 50 ml at room temperature. Gently grasp auricle and straighten ear by pulling pinna down and back for children younger than 3 years or upward and outward for patients 3 years of age and older. Slowly instill irrigating solution by holding tip of syringe 1 cm above opening of ear canal. Allow fluid to drain out during installation. Continue until you use all solution. Clean area and put supplies away. Help patient to comfortable position. Place nurse call system in accessible location within patient's reach. Raise side rails as appropriate and lower bed to the lowest position. Dispose all contaminated supplies in appropriate receptacle. Remove and dispose of gloves and perform hand hygiene. Record medication, concentration, dose of strength, number of drops, site of application, left, right, or both ears, and time of administration on MAR immediately after administration. Observe response to medication by assessing hearing changes, asking whether symptoms are relieved, or noting any side effects of or discomfort felt. Ask patient to discuss purpose of medication. action, side effects, and technique of administration. Record patient's response to medication, patient teaching and validation of patient understanding and self-administration on flow sheet or nurse's notes in electronic health record or chart. Use teach back or I want to be sure I clearly showed you how to administer eardrops. Let's take this time we have for you to show me how to place eardrops in your right ear. Revise your instruction now or develop a plan for revised patient or family caregiver teaching if patient or family caregiver is not able to teach back correctly. Determine patient's family caregiver level of understanding of instructional topic.